So redefining roles. I think that the fact that a patient blogger follows a policy and business expert like Professor Christensen up here at an event like this is definitely testimony to the fact that roles are being redefined. So I want to thank the Mayo Clinic for having me here today. Appreciate it. So in many respects, I'm the poster child for health social media. It literally has changed my life. And I didn't choose this direction myself. I'm a former technology journalist, and I was diagnosed myself with type 1 diabetes at the age of 37, right after my third child was born. So as you can imagine, I was quite shocked and just blindsided, and even the doctors seemed baffled that someone my age would suddenly show up with what used to be called juvenile diabetes. So, like so many others before me, I felt isolated and generally just confused how to deal with this thing. So I went looking for information and for help and community. And at that time, which was 2003, 2004, I did not find what I was looking for on the web. But I was actually very fortunate that blogging was just coming to the forefront. So here was this new tool for anyone to self-publish on the web. So I was able to actually create the site that I was looking for myself by sharing my own knowledge, reaching out to other people who are walking in my shoes, and learning a lot in the process. And so this was the birth of my site, diabetesmind.com, which has now grown into an information resource and community networking place for people affected by diabetes. And I found that not only for patients, but for the community, for friends and family members, it really means a lot. And I even have a section on the site for partners of diabetics and realizing their perspective on the illness. And also to parents of children with type 1, how important it is for them to see what kind of adult lives people are having with this illness. And I found that even my own mother says she's learned a lot about what I'm going through just by reading the blog. So for me, creating the blog and writing about my illness was actually a big step in kind of redefining my own role in my healthcare. So Professor Christensen introduced the term facilitated networks or user networks, and in the context of cost savings. And I think he's absolutely right that for the system, the value of these networks is cost savings and increased access. But for us patients, cost savings is not the #1 driver for going online. In fact, the real value to patients is in better care. And that actually comes in 3 flavors. So information or shared education, emotional support or community, and then advocacy. And I'm going to go through the 3 of those. So again, not that it was my choice, but I somehow landed in the middle of diabetes, and I'll use many examples today in my talk about diabetes, but I want to point out that these concepts apply across patient conditions. So for information and shared education, this kind of goes back to the notion that most people only see their doctor maybe 7 minutes every 3 or 4 months if they're lucky. And then basically you have to figure out the rest on your own. And other patients are a huge resource about treatment options, but also about the day-to-day concerns of living with an illness. So the classic example in diabetes is people being sent home with a glucose meter and not given any real understanding of how it impacts their health. So, why would you keep poking your finger and taking blood? This is a very unpleasant thing to do if the results of these tests don't mean anything to you. And then they talk about patients being non-compliant. So people need an education about their disease that is, it really addresses real life, and it can't be one-size-fits-all clinical information. And when I say dynamic education, I actually mean that it's interactive, that it's ongoing, it's not a one-off session, and that it comes from real-world experts, people who understand what it's like to be out there with this illness every day of your life. And patients are seeking that education on their own. They become very active on the internet, on these sites that didn't even exist 4 or 5 years ago. So what are they doing there? So what I'd like to do is share a few statements from a new social network called Diabetic Connect, and I'll talk more about that in a minute. But some of the questions people ask on this site, I find shocking, but at the same time, I'm so glad that people are asking these questions because it shows that they don't understand. They realize that they don't know enough about their illness. So many people tell us that no one ever explained to me how and why to use the numbers on my glucose meter. and that I'd be better off if I had learned that long ago. And some patients aren't even sure, for example, if they need a glucose meter. So here's a woman who's experiencing low blood sugars or hypoglycemia, and she doesn't even have a way to test her levels. So that's actually really dangerous. And then we get very basic questions. Once again, why do I even need to do this? So no one's actually explained to many of these people that testing is about the long-term bodily damage that diabetes can do, and that this testing now is going to have an impact on that later. And here is a comment that we get very frequently. People come on and say, I've learned more in 24 hours here on the site than I have in a whole year from my doctor. So patients are visiting these sites, and if you want to know what they're really doing on these networks over time, we have some data here on people with diabetes in particular. They are learning about new drugs and devices. They're learning more about their disease itself. And they're just visiting regularly for a sense of involvement. I think that's very powerful. And by the way, the data on this site, on this slide comes from Healthy Outcomes, which is a new site. It's not a peer-to-peer network, but rather a sort of educational and reward system. So people go, sign up, they are routed through some educational modules, and then they take quizzes. And depending on their score on the quizzes, they can win tons of prizes. So we're talking retail gift cards, luggage, jewelry, you name it. And this may sound trivial, but it's actually extremely successful so far. If you want to talk about how to motivate behavior change, people need tangible incentives, and they love to win things. So that was education information. Now we come to the second aspect of better care, which is emotional support. These communities, these online communities, add the human factor to the healthcare system that the pharma companies and health insurers just can't provide, and that doctors and nurses really don't have time for. So I mentioned Diabetic Connect. For over a year now, I've been community manager of this new Facebook-like site for people with diabetes. And it's one of the fastest growing online patient communities. So it's got nearly 50,000 members in just over a year. And of course, we have discussions and video sharing, but we also have a lot of features that are tailored specifically to diabetes. So there's a big recipe area, there's a book club, and there's a product reviews area similar to an Amazon product review, which I think is very powerful because where else could you ever go to find out what other people's experiences were with particular models of glucose meters or pumps? Is it comfortable? Is it, is the screen big enough? Can you see it? People can talk about those things. And also, getting back to emotional support, in the discussions area, the topics originally were things like diet, and medications, and supplies. And I actually had to ask the developers of this site to add a section for motivation/emotional support. And that is now one of the most frequented areas of discussion. So thinking back to when I was diagnosed, how I could have used an online support group like that to just talk to people about how you feel. We do in this country tend to have an every man for himself mentality, but I think this really proves that people do want to tell their stories. They do want to reach out and help other people. And by the way, there are sites like Diabetic Connect, of course, now for any major condition: cancer, ALS, sleep disorders, thyroid disease, you name it. So people are calling for help actually both emotionally and financially. We hear from many people who don't have adequate access to health care or don't have adequate coverage. And some of the stories really are heartbreaking, and I wanted to share one from this 53-year-old woman in Earville, New York, who says she can't afford her medications. She writes, "I don't have any health insurance, and it's very difficult when you have a major disease. I'm supposed to be on diabetic medications, and I just can't afford it. I called Walgreens, and it's $250. I'm on Social Security, so I just don't have the money. It means that I'm committing suicide slowly. That's what it means." So, we try to share tips on patient assistance programs, but I really wish that there was more we could actually do to help these people. At the same time, I do think that these gathering places, these facilitated networks, can bring hope and change for the better. And a big part of that is the transformation of the experience of being a patient. So we can survive, we can live normal lives now, we're not laid up in hospitals. And social media is enabling us to have this collective voice that we never had before. So we can, for the first time, speak back to the medical establishment and to the pharma industry and the device companies that make these contraptions that keep us alive. And this brings us to the third aspect of better care, which is advocacy. We're finding that these new channels also provide a great platform for sort of grassroots advocacy. And in the past, for example, if a new technology or treatment came out and it was denied by your insurance, you had no recourse. You were in a vacuum, essentially. You had no way of knowing whether other patients had experience with this, whether their doctors were able to get a successful appeal. And a great example of this is this grassroots campaign. It was an online petition called Anti-Denial for Continuous Glucose Monitoring. So new technology has the potential to be life-saving for people with diabetes, and the insurance companies are pushing back. So a woman who had a smaller site for diabetes started this online campaign. It created a lot of buzz, it got a lot of people involved, and eventually a national advocacy organization, the Juvenile Diabetes Research Foundation, got on board and began to lobby with her, and they began to turn the health plans around. So it actually had an impact. So for the first time in history, these wired people, these wired patients with chronic care needs are really changing the balance of power in favor of the patient, instead of just solely in the hands of the medical establishment, pharma companies, the doctors and insurers. So in my case, I've actually chosen health design as sort of a platform for advocacy, and it happened sort of by accident. So it began when I penned this tongue-in-cheek open letter to Apple CEO Steve Jobs in spring of 2007. And the idea was just to call for the gurus of consumer design to kind of get together with these R&D specialists in the medical area and start making these devices more livable, more desirable, more personalizable, essentially more like the consumer electronics that we have nowadays. And this created quite a media virus. It was picked up all over the blogosphere, in mainstream media, got a lot of patients talking, and eventually started to create some waves in the industry, which is very exciting. So I never did hear back from Apple directly, but a design firm in San Francisco called Adaptive Path came forward and said they were interested in developing a prototype of a combination glucose monitor and insulin pump controller device. And their team did this, and they called it the Charmer. And as you can see, it's about the size of a USB stick, and it has a flat touch screen. It's got color. And it can be worn, because of that little hoop on the end, it can be worn on a necklace or it could be worn on your keychain. So thus the name Charmer. And it's really unlike any other diabetes device that I know of that's ever been designed, simply in the fact that it's much more desirable to live with, much more appealing. So this is still a prototype, but I know that the company, it's gotten a lot of exposure, and the company is now actually talking with manufacturers. So out of this grew this sort of crowdsourcing campaign, the idea for this online contest that would be hosted on my site called the Diabetes Mind Design Challenge. And as you just saw, this year we were able to, with the help of the California Healthcare Foundation and this $10,000 grand prize, we were able to take it to a whole new level. So the global design firm IDEO was also involved in judging and helping with the winners, thank you, and also medgadget.com, which is another internet site for emerging medical technologies. And again, it was a web-based interactive contest. We took YouTube videos, and you could upload paper documents to another site as submissions, and we had over 150 entries this year, including dozens from leading universities like Berkeley, Harvard, Stanford, USC, MIT, University of Mexico, and many more. So this year's winner was a system that actually turns the iPhone or any smartphone into the controller for a combined glucose monitor and pumping device. And so the idea was, rather than create some separate medical technology, why not blend the consumer device that we all already use and carry into something that meets our medical and health needs as well. And this design came from 2 graduate students at Northwestern University. So needless to say, participation in this transformation that we call Health 2.0 has made all of this possible. So for the first time, parents and caregivers and people touched by diabetes can be actively involved in the design of the medical devices that shape our lives. So now, before I offer some concluding thoughts on where we need to go next, I wanted to share this video with you, which I think illustrates what this all means to us patients. Thank you. So that's how far we've come. We know that we're in the middle of a seismic shift. So where to go next? From a patient perspective, I would say we've joined the conversation, but now it's time to be invited to join the system. Let me get back to this newly diagnosed person with diabetes. So you go in, and your doctor communicates your diagnosis, and with that hands you a recommendation for glucose monitoring and maybe some papers about diet and activity, and then you're generally on your own. They send you out, go off and do it. Well, what if the same doctor in the same diagnosis session actually acknowledged that he or she does not have this illness and therefore doesn't know what it's like to live with it, and doesn't have time to do a deep dive, but in fact there are millions of people out there who do know what it's like to live with this illness. In Professor Christensen's words, he would be sort of decoupling the diagnosis from the day-to-day management. And the next step would be to actually integrate patient communities into the healthcare process. And let me give you an example of that. So imagine a secure personal website that you would go to. Your health providers automatically upload all of your relevant data, so electronic health records. But based on your health conditions, you would also get links to recommended facilitated networks like Patients Like Me or Diabetic Connect, or better yet, what if the same site could actually walk you through personalized health information and advice based on your history and the parameters that you entered? I'm actually working on a project along those lines that will hopefully embody the future of what facilitated networks can evolve into. So let me introduce you to Dr. Richard Jackson. He's a top-notch endocrinologist from Joslin Diabetes Center in Boston and my partner in crime. Together, we wrote a guidebook for patients with diabetes in 2007, and we're actually in the process of converting the content of that book into an actionable web-based tool for patients. And I would say that our partnership is also sort of testament to redefining roles, because here is a clinician with 25 years of clinical and research expertise under his belt, and he's partnering with a patient advocate in order to make an impact in the patient community. And I think that's why our book was so well received. And I'm just thrilled to have become a patient in a time when that term actually has some positive connotations. So with that, I would like to say thank you for having me again.